Hello, everybody, and welcome back to the Here For You podcast. I am your host, your professional geek, Carlos Parra, with carlosparra.com. I am your content creator, your moderator, and of course, we welcome back Dr. Cristi Moore from Sonora Hearing Care in Tucson, Arizona. And last week, we had a special guest, and we were like, we loved it so much. Let's do it again. So today, we have a special guest, Susan Smith.
Yay!
So Susan Smith, you know, when Cristi sent me your bio and your link, something intrigued me because I saw storyteller.com and I was like, wait a minute, why are you known as a storyteller? So if you could please just fill us in with that.
I'd be glad to. I've been Susan Storyteller for years. It was started as a side gig for me. I was a banker for 28 years. I retired from that. I became a jewelry designer. But my whole life I have written. I've written articles for magazines back when you had a real magazine. I've written, I write blogs, I write memoirs. I've written many memoirs for people. And I began teaching people how to tell their story. So when I found the name Susan Storyteller and I could use it as my website name, I thought, why not? Then people will know what I am. So I tell stories of other people. I tell the stories of my own life. And now in particular, I'm telling the stories of women survivors of heart disease. And it has just stuck. And I figure after all those years, who wants to change the name of your website, you know?
Right.
Yes.
Right.
Yes. And in my business, you don't ever want to do that. You want to keep that domain name as long as you possibly can.
Right.
Susan, so you touched base on something where you're also known, not only as a storyteller, but as the Women's Heart Champion. Can you expand on that?
Oh, it was such a wonderful thing for me. See, I had a heart attack in 2018 on a day when I certainly didn't have time to be bothered with something like that. And I didn't have what I thought were the traditional heart attack symptoms. I had a collarbone ache. I was short of breath, lightheaded, and tired. And those were things that many women might have every once in a while, and we just think they're going to go away. And when you're a busy woman with a family and people to take care of, you know, you just push through that stuff. But anyway, I had this heart attack, and a few months after that, WomenHeart, the National Organization for Women with Heart Disease, reached out to me. They select 50 women a year who have survived a heart attack like me. They take you to the Mayo Clinic in Rochester, Minnesota, and fill you with training for 4 days about all things heart disease in women. They send you back to your community to educate, support, and advocate for women with heart disease. So once I returned home, I started a support group in collaboration. TMC helped me do that. I have a support group. I speak to anyone that will listen, groups of women, whether it be 1 or 100. I am out in my community at every health fair before COVID, we could go and represent Women Heart at events like that so we can spread the word. So that's how that happened. And once I received that honor and the training and all of the goodies that they give me, I've been advocating ever since.
That is amazing. I love that because this tragedy, or what most people would look at as a tragedy that they may overcome and just continue on with life. Like, you've embraced that and been able to educate people. That is phenomenal. Just thank you for that. That is just absolutely amazing. And just being able to change people's lives with that is just fantastic. So thank you so much for all your work. Now, Dr. Moore, what is your experience with heart disease?
So I have not experienced heart disease personally. I have family members that have, obviously. But then as an audiologist, one of the things that we learn about are comorbidities or diseases that can also be affecting your hearing, or how hearing can affect when you have these other diseases or disorders. Heart disease is one of the number one diseases that affects Americans. And so, but hearing loss can also be a risk factor when you have heart disease. And a lot of that has to do with the blood flow. So when you have heart disease, then we know that your blood flow is affected because either due to blockage or restriction of blood through the arteries and veins. Therefore, since hearing, the organ of hearing, is so important and fed by blood flow through our body, that can affect the tiny neurons, the tiny neural cells in the inner ear from receiving the proper amount of blood flow, which can affect their ability on how they interpret that sound as well. So heart disease is one of the things that can also affect your hearing later on in life. So that's one of the things that we always ask in our clinic. Do you have heart disease? Because if you do, then that puts you at an increased risk of developing hearing loss that you may or may not be aware of. So that's where we are trying to do our best at educating physicians as well. When you're talking to your patients, ask them about their heart health, or if you know that they have heart disease, or you're concerned about their heart health and vascular system, then by all means, let's get them in for a hearing test. Let's find out if that's also affecting their ears too.
Wow. How amazing that, well, and again, the human body is amazing, but just to see how the two kind of interact and one supports, something is supporting the other. And it's always amazing to see that. I'm always blown away. I'm a geek. I'm not a doctor. And so, okay. So then you kind of touch base on this, about your symptoms, right? What are some of the symptoms that women should look for when, that they could possibly be experiencing a heart attack?
This is my favorite topic. Thank you for asking me. So men and women both have heart attacks. I will say that heart disease is the number one killer of women and of men.
Yeah.
And so the public doesn't realize that number one killer of women is heart disease. Many think it's breast cancer, and breast cancer takes the lives of 1 in 8. Heart disease takes the lives of 1 in 4 women.
Wow.
So men have what I call the Hollywood heart attack. It's the kind that you may have seen in the movies or read in a novel, where they start sweating and they have pain down their arm. They have crushing chest pain. They bend over, they clutch their chest, and they fall to the floor. I know you've seen that image.
Yes. Well, man,
yes.
Dramatic as well.
So that's what I thought heart attack symptoms were: crushing chest pain, that arm thing. Well, women present differently. Women have different symptoms than men. We're different than men, obviously.
Yeah.
And so what happens is, one of the number one things is shortness of breath. And we've talked about blood flow and how important that is. So your heart pumps and sends blood flow to all of your body parts, and that blood has nourishing oxygen. One of the places it goes is your lungs. And so when you're short of breath, your heart isn't reaching there with blood flow. Mm-hmm. So these are the symptoms that women have. I tell women, just think about your upper body, starting at your rib cage up to your nose. A man can say, I have chest pain. We all know where our chest is, where our heart is. But a woman, if you have any discomfort in that area that I just described, discomfort means pressure, squeezing, tension, just anything that's not comfortable. It's not chest pain. So when you have a pain in your jaw, your neck, your collarbone, your shoulder, your back, your sternum, all the way down to the bottom of your sternum, and you think maybe that's indigestion, those things are uncomfortable, and those are symptoms. shortness of breath, lightheadedness or dizziness, unusual fatigue, sweating. They're things that you don't associate with that Hollywood heart attack.
Right.
So those are symptoms for women. And I preach it all the time. Once you know these symptoms, then you can pay attention to them.
Mm-hmm.
My problem was I didn't know them. And then when I had them, I ignored them because I was too busy that day.
Yes. Well, you
Yes.
know, and I think that's part of our hustle and bustle of life, right? Where it's like,
Yes.
we don't have time for this.
Yeah.
And what's amazing to me is how we can ignore our body telling us, hey, something's going on. We need to stop. But with that ignoring, so Dr. Moore, you know, we see the symptoms that people can ignore or just not even know that they're having. Are there other symptoms that would affect people's hearing that we would ignore or just, you know, put off as something else when it comes to hearing loss?
Absolutely. So the biggest thing is that, you know, people don't realize that they might be losing their hearing. They may think, well, I didn't hear what was said in that conversation. Well, maybe that person was speaking too fast. Or, you know, I was in another room, so I didn't hear what was being said. Or, you know, it's the phone conversation. Okay, it must be the phone that isn't clear. The TV, oh, they just talk too fast. Those are all things that a lot of people try to tell themselves. Yeah, well, I'm not having a hearing problem. It's not my ears. It's all these other factors. You know, it's everybody else isn't talking or speaking clearly. That's why I'm having trouble understanding. That's why I can't hear. So those are some symptoms that usually are one of the first signs. Sometimes there can be other symptoms. Sometimes you can have some dizziness or balance problems, which can be related to hearing. Sometimes you can have the ringing in the ears or tinnitus. That can also be a symptom that you're starting to have some hearing loss or trouble with your hearing. So whenever you have those symptoms, okay, if you're having difficulty understanding people, whether it's in a crowd, whether it's one-on-one, whether you find yourself having to turn that volume up just a little bit louder on the TV or radio, it's a great idea to come in and get your hearing checked, because we can identify how you are hearing through tones, through speech and quiet, speech and noise. We can check the pressure in your ear. We can find out how that entire auditory system is functioning. And if anything is abnormal on the test, so there's a lot of things we can look for, which I can go into more detail about, but basically there are some things that when we look for, is the hearing the same in each ear? And if it's not, then that could be a sign that something is medically causing that hearing problem. So just by having a hearing test, a lot of times we can see if maybe there is reason to refer you to another medical professional for something else that could be related to that hearing loss.
Great. Thank you so much. So we can see how things can easily be ignored, right? Because as people and as humans, we don't want the bad news, right? Life needs to be happy. Life needs to be good. But Susan, how can we educate our viewers and our listeners on, heart disease? How are there resources that they're able to go to find and kind of educate ourselves?
Yes, there are resources that I have on my website. I list them all, but of course you can go to WomenHeart, American Heart Association, and they have all of the resources. But I like to just tell you and tell the public that if you want to know about your own heart health, then you can go to your primary care doctor and get a heart baseline without getting a specialist, without going to a cardiologist. And then you can know going in right now today what your heart baseline is. And that is to measure these 4 things: your blood pressure, your weight and your BMI, your cholesterol, and your blood sugar. Then while you're measuring these things, your doctor will tell you if any of them are out of a normal range. And normal range is, standard for you and your age and your gender and all of that. But the other thing you have to add is tell your doctor of any family history.
Right.
And if you have I tell people to go back as many generations as you can, always your grandparents and the next grandparents above that, if possible. If they had heart disease, died of a heart attack, anything that you know of, then you are genetically, you need to tell your doctor that. So that's the one thing you can't control. But the others, blood pressure, your weight, your cholesterol, those things are easily controlled. So get your baseline. And if it's all good, then just update it every year.
Awesome.
Thank you so much. And we'll have your website in the description. That way people can find it who are viewing this on YouTube. So, Dr. Moore, so, and again, you kind of touched base on that with the link of the link between heart disease and hearing loss. Is there anything more you wanted to elaborate on that?
I think I covered it mostly. It's very interesting how so many things can affect hearing, or that hearing can be a risk factor when you have certain diseases like that. So I would just say, again, anytime that you have something that's causing or restricting blood flow to your heart, whether it's vascular disease, so how well the blood flows through your body, whether you have high cholesterol, high blood pressure, heart disease, because you've had a heart attack or not, or stroke, those are things that can be then potentially cause you to have a higher risk of developing hearing loss. So again, any of those factors, it's always a good idea, especially once you reach the age of 50, to get a baseline hearing test if you haven't had one. And then just like with Susan saying, that's something we recommend every year going forward, so that we can monitor that, and we can monitor for any changes in your hearing health as well.
Awesome. So I'm 5 years away from have that mandatory.
Yep.
Okay, Susan. So we talked about the resources, right? So, but what are some things that people can do like right now to help strengthen their heart?
Okay. I want you to know that 80% of heart disease is preventable through lifestyle and diet changes.
Awesome.
That's pretty high. So here's some things that you can do and things you can give up. Lifestyle factors. Give up smoking. Get some physical activity, and don't drink too much alcohol. Those are all things on the no list. Those are things you can give up. On the to-do list, you can eat a heart-healthy diet, and I will mention the Mediterranean diet, but so that means you're eating low fats, low sodium, and you're eating heart healthy. Exercise, it can be 15 minutes a day, 15 minutes 5 times a week. And it can be walking, you can play pickleball, you can go swimming, just do something you like so that you do it. Then just get your heart rate up so that that exercise is helping your heart. So heart healthy diet, exercise, watch those lifestyle factors, and just kind of take charge and make sure, like Cristi said, you get a baseline and that you're monitoring your own health.
That's right.
As a web developer, I sit down most of the days. I do have a stand-up desk, but after this podcast, I'm gonna have to go for a walk.
Me too. Exactly.
Now, Dr. Moore, are there steps that people can take to prevent hearing loss?
Well, it's very interesting. There are some factors similar to what Susan was saying about heart too. One of the easiest ways to prevent hearing loss is to protect your ears from loud noise. So if you work in an environment where you're around loud construction noise, or you're around loud machinery, you're doing activities like shooting or hunting or something like that, or even using power tools at home. If you put in earplugs or you put in on ear muffs, that is the number one preventable way that you can prevent hearing loss. Whether you're a young child, a teenager, young adult, older adult. So that is something, and also earbuds too, listening to loud music, whether it's at a concert or whether through an earbud or headphone. Those are things that we can all do to prevent that. The rest of hearing loss sometimes is maybe we don't have as much control over. So there's going to be genetic factors too. Some hearing losses are genetically predisposed. So if that is part of your makeup, unfortunately, there's not much you're going to be able to do about that. There's some environmental factors. There's some medications that can cause hearing loss. Sometimes people have to be on certain medications for other types of diseases or disorders. Unfortunately, sometimes a side effect of that can be hearing loss. So there's certain things sometimes you can't prevent with that. But just like with what she said with, helping to prevent heart disease down the road, we always say too that, exercise is going to help keep your ears healthy, because again, blood flow matters, and it matters to receiving that in those tiny hair cells in the inner ear. Having a healthy diet is going to do that as well. So, if you have a low fat diet or like the Mediterranean diet, again, you're eating more of a whole foods diet. Again, that's going to help your overall body, which again can help your blood flow, which can affect your hearing too. So those are things that we would say in our industry, there's a few things you can do to prevent hearing loss, and there's some things you can't prevent it. And so you just have to know what you have control over, what you don't have control over, but what you can do to either prevent further hearing loss from happening, and then take steps to, once it has developed, to making sure that you correct it in a way that gives the brain the information it needs from all the auditory stimuli, whether it's speech, sound, music, etc.
You know what? This is amazing. Thank you so much, guys, for sharing this. It makes me realize I need to step up my health.
We all do.
Yes. But, just learning so much about the differences in what people, we ignore just out of denial, I would say, as humans, but things that we can look out for to educate ourselves. This has been phenomenal. Thank you so much. Susan, where can people find you?
I'm on the web at susanstoryteller.com. And on that website, I have resources, and I put the support group, not only my own support group, but other support groups here in Tucson. And then I have support groups that are online for women. It's one of the most important things we can do after a heart event, whether it be a heart attack or something, is to get into cardiac rehab, which strengthens your body and your heart, and then get into a support group so that you can talk to other women that look like you, have experienced what you have, and you can talk through some of these issues, because it's an emotional roller coaster of a time. So I list resources, which are the different support groups and the different scans and testing available. I list, I have all my blogs, and then I have interviews on there of women heart attack survivors. And so that they could start there. And then I highly recommend Women Heart National, and they're at womenheart.org.
Awesome. Thank you so much. And again, viewers, will have Susan's information down in the description below. We'll have links going out to her website. Dr. Moore, where can people find you?
Oh, yeah. So I own Sonora Hearing Care, which is an audiology practice here in Tucson. And so we're located kind of on the east side of Tucson, Granton and Craycroft area. We have our website, which is sonorahearingcaretucson.com. And we also have our Facebook page. We're on Instagram, Twitter. And so you can find us on all of those social platforms as well. I also have a LinkedIn account too, where you can find me under Cristi Moore as well.
Awesome. Yeah, Dr. Moore, Susan, thank you so much for just sharing your knowledge. And viewers, we thank you for taking the time to watch this video, to listen to the podcast. Feel free to like, subscribe, click the little bell for the notifications that you'll receive emails once new content goes live. Again, we thank you so much, and stay safe. Bye.
Thank you. Bye.